focus would be treating the hormonal imbalance, and we would just leave the fibroids alone. You see?
Yeah. So
it's really dependent on what determined that the fibroids are the cause of the symptoms. Then there's many things we have to consider in terms of choosing the proper treatment. Number one being, what is the main symptom the woman is having? So if the main symptom is abnormal bleeding, and let's say she either is not interested in fertility, meaning having a child at that moment, not in the future, but just at that moment or within the next year or two, she's not interested in having a child.
Or maybe she's done giving birth.
Or maybe she's done with her childbearing. Then in that case, we would try to see, okay, are you just okay with just treating the symptoms related to the fibroids, meaning the heavy bleeding, if that's the main symptom, or do you want to have the fibroids just gone altogether? And so based on her desires for fertility, what the main symptoms are, and what the size and number of the fibroids are, that's what determines what you choose in terms of the treatment. So there can be medical treatment where primarily it's hormones or family planning, so birth control pills or sometimes some other hormonal medications which can be used to control the bleeding. Family planning is not just for birth control or controlling the number of pregnancies or preventing pregnancies. It also can be used to help regulate and lessen the flow of the menses. It also small, they're not causing too much in the way of pain, etc. There's not a need for pregnancy. Some women need to be pregnant right now, like contraceptives, etc., just to control the heavy menstrual flow being caused by the fibroids. And sometimes that's all you need. Now, if a woman does want to conceive, or let's say there are many fibroids, or the fibroids are very large, or to the point where it can cause symptoms like lightheadedness, dizziness, heart palpitations, which means that your heart is beating faster because you have less blood in your system. It can be quite dangerous depending on how low the blood count goes. So in those cases, that's where you start to consider maybe some medication treatment or hormonal treatment, and then the next step, which would be surgical removal. So for women who want to conceive or maintain their fertility or just don't want to part with their uterus, which we'll talk about later, in that case, that's when you consider surgical removal of the fibroids. Okay, surgical removal of the fibroids could be just taking the fibroids out and leaving the uterus in place. Obviously, if a woman wants to conceive, we would do that first. Also, if a woman is done with childbearing and they're maybe of older age, maybe getting closer to menopause, and they want to have conceiving anymore. So in that case, you can choose what's called hysterectomy, where you remove the entire uterus and thereby all the fibroids at the same time. So, you know, there are other treatments. Women also frequently, a woman chooses surgery for fibroids. Many times you may need to do a hormonal treatment. Again, if there is anemia and the blood count's low, you don't want to go into surgery with a low blood count. It just increases the risk of surgery and it makes the recovery less optimal, okay? So in that case, sometimes you need to give hormonal medication to stop the menstrual flow so they're no longer losing blood and allow the blood count to build back up to normal. And then thereafter you would do the surgery. So sometimes it's a combination of treatments that you will need to do based on the woman's condition.
Is it possible?
You can tell me whatever you want.
Okay, it's my own.
You can tell me whatever you want. But in general, we always want to prepare. Surgery is never a light undertaking. You know, any surgery is a major undertaking because it's anesthesia, medications that you will be getting that alter your blood pressure and your heart function, and also you're having cuts made on your body. And so it's important to make sure that we do some preliminary evaluation to make sure that it is safe for you to undergo surgery and that as much as possible all of the conditions are as optimized as possible. You know, there are some women, you know, again, fibroids affect women in their reproductive ages, so that's all the way from the teens to early 20s all the way up through menopause. As we women age, men as well.
Yeah.
It's more common for us to have other medical
Yeah,
conditions.
yeah,
So
yeah,
sometimes
sure.
hypertension, diabetes, other conditions, even thyroid conditions,
Yeah,
things that we need to make sure are well controlled before we go into surgery. So, as long as any pre-existing medical conditions are well controlled. So let's say a woman does have high blood pressure or diabetes or any other condition, but I see that she's on medications, blood pressure is well controlled, or her blood sugars are well controlled, then in that case, usually within the next 1 to 2 weeks, we can go ahead and schedule.
Okay.
However, for the younger women who may not have any pre-existing medical conditions, but let's say if the main symptom from the fibroids is heavy bleeding, I need to make sure her blood count is well controlled, or her blood count is at a normal range, I should say. Obviously, when you have surgery, you're going to have incisions made. It's not uncommon that you'll have some blood loss, especially when you're coming with fibroids and you're going to have surgery for it. Sometimes there can be a lot of blood loss because, like I said, fibroids cause new blood vessels to grow around themselves. So if I do see evidence of anemia, I may say, it's better if we build your blood count back up to normal. So we go into surgery with a good blood count. So even if you lose some blood, it won't affect you as much in terms of causing severe anemia. Okay, severe anemia is not good going into surgery. So we may need to do that. Additionally, there are other people involved in doing the surgery, not just me. So there's the anesthesiologist, the nurses, etc. And I work with other specialists as well, and so we all share our theater. So we want to make sure that we time the procedure in such a way that the anesthesiologist also has a chance to review the woman's medical history and make sure there's nothing else that needs to be done. If there are any other testing, and there frequently are other tests, blood work that we need to check in preparation for surgery, we usually do that ahead of time. And then we also make sure we set the schedule such that it doesn't conflict with other people. So sometimes people wonder why they can't get their surgery tomorrow. We plan everything, and it's all in recovery.
Wow. Just a quick one. Is it safe for pregnancy to be side by side, or fibroids, the uterine fibroids to be side by side with pregnancy? Yes,
it's very common, in fact. So that's the reason why I said it is not always the case that fibroids can cause infertility. There are many difficulty. And so in those cases, it's usually the case that maybe they have some few fibroids, they're small, and we don't worry about them at all. There are also some cases where sometimes there are large fibroids, but the woman still conceives. We don't do anything with the pregnancy, we just watch and see what happens. However, we do know that the larger the fibroids are when a woman conceives, the more likely there may be pregnancy complications. So sometimes, like I said, if there are fibroids within the muscle wall of the uterus and they're large, it could be the case that because they are also expanding the uterus, it's kind of taking the space that the baby needs to grow. And so it could be the case that there could be increased risk of miscarriage, there could be incidence of preterm labor. Term is when the woman goes a full 9 months or 10 months, as we doctors like to. So but in general, 9 months is a full term. But prior to that, so prior to 37